Rocky. I'll be doing your assessment today. I'm the student nurse practitioner. What brings you to the clinic today?
I'm here for a heart exam for work clearance.
Okay, good. This video is going to be uploaded on YouTube for the course. Is that okay?
Yes.
Okay. So before I start my assessment, I'm going to check the patient's blood pressure, supine and sitting up to both arms, checking and comparing the two. I'm also checking for any blockages. Now I'm going to be inspecting his neck. I'm also going to be checking his jugular venous pressure. So you can go ahead and lie down. So patient's going to lie down 30 to 45 degree angle. And he's going to turn his face. Can you turn your face to the side? Good. Okay, so I'm going to be placing my ruler, like a metric, to the sternal end of the notch. And I'm also identifying the highest point of the internal jugular vein pulsation. I'm taking a flat straight edge and placing my metric system or ruler measuring onto the sternal notch. Okay, it's right about here. Okay, so it's about 3.5 centimeter. The normal is about 3 to 5 centimeter. So you can go ahead and sit up for me. So after I check his jugular venous pressure, I'm going to be checking for his carotid arteries. So making sure that I only do one at a time. So I'm going to go ahead and palpate, checking for any thrills, leaves, or lifts. Any tenderness? No. This is the carotid artery, and then I'm also going to be checking the other side, making sure I compare the two. Okay, good. Both are strong and equal bilaterally. And then now I'm going to be auscultating with a bell and a diaphragm, checking for any bruits. Okay, comparing the two sides. Good. Okay, and then now I'm going to be checking with a bell. No bruits noted bilaterally. Okay, after I auscultate for the carotid, now I'm gonna check his chest. First, I'm gonna be inspecting. I'm inspecting for any abnormalities. I'm inspecting the shape, noting if there's any barrel chest, any deformities as well. I'm also inspecting for the color, the color of his chest, both anteriorly and posteriorly to both sides. After I inspect the shape and the symmetry of his chest and any abnormalities, I'm also checking for his for any apical or precordial pulsations. But no pulsations noted upon inspection. After inspection, I'm going to go ahead and palpate the apical, which is the second intercostal space to the right sternal border, pulmonic, which is the second intercostal space at the left sternal border. And I'm also going to be palpating for your Erb's point, which is at the third intercostal space, left sternal border, and tricuspid, which is at the fifth intercostal space, left sternal border, and your mitral, which is your fifth, which is located in the fifth intercostal space, midclavicular, to the left side. And that's also your point of maximal, your PMI, point of maximal intensity. So I'm going to go ahead and palpate. So second intercostal space, and you let me know if there's any tenderness or pain.
There's none. Okay?
And I'm also palpating for any thrills, and I'm gonna go down to the third intercostal space, and then I'm also palpating for any thrills, leaves, and lifts, and then to the fifth intercostal space. I'm checking right over here. And if there's a large breast tissue, I would obviously ask the patient to lift the tissue to the side. Checking the mitral and PMI as well. After I'll palpate for those, I'm also going to be palpating for the abdominal aorta, which is above the umbilicus to the left of the midline. So palpating for any thrills. Is there any pain?
No.
No. Any tenderness or discomfort?
No.
Okay, so checking for thrills and see if there's any pulsation too. Okay, and then after I palpate, I'm gonna go ahead and auscultate the same points. I'm just gonna grab. So I'm gonna be auscultating the same points: the apical, pulmonic, Erb's point, tricuspid, and mitral. And I'm also going to be auscultating for physiological splitting of S2, which is the closure of the AV, the aortic and the pulmonic valves. And this is best heard on inspiration. So I'm going to go ahead and ask him to take a deep breath as well with that. So let's go ahead and auscultate. So I'm going to be auscultating both with the diaphragm and the bell.
Deep breath?
No, not right now. Okay, noting S1 and S2 with no extra sounds. Take a deep breath. S1 and S2, no extra sounds noted. Okay, and then one more. I'm checking for PMI as well. So now I'm going to be auscultating. With a bell. So same areas. Noting S1 and S2. Good. Okay, and one more. Okay, good. So after I auscultate, after I auscultate these areas, I'm also gonna be auscultating at the abdominal aorta. So you can go ahead and
45 degrees.
you know how. Okay, go ahead and lie down for me. Checking for any bruits. And also try the bell. Okay. Okay, you can go ahead and sit up. After I auscultate, I'm gonna be checking, doing a peripheral exam on him. So I'm checking for his color to bilateral upper and lower extremities. I'm comparing the two sides as well. To all extremities, so the color, and I'm checking for any cyanosis, edema, varicose veins. I'm also checking for any abnormalities as well, such as the varicose veins, edema, shunts. I'm also going to be checking for warmth. I'm checking temperature to all his extremities, making sure that it's warm bilaterally or it's the same bilaterally. After that, I'm going to be checking for pulses. I'm going to be checking for both pulses at the same time, noting if there's any difference. So first one is the radial. So I'm going to be checking. You can just relax. making sure it's both strong and equal. Okay, and the brachial. Okay, I'm also going to be checking on his femoral pulses, but which on a clinical setting, I'll ideally have the patient remove his clothes, but not at this time. So I'm gonna be palpating for thrills at the femoral arteries as well as auscultating for any bruits. And now I'm gonna be checking his popliteal pulses behind the knees. So I'm gonna be cupping my hands behind his knees, and then moving it along as I feel the pulsation, making sure it's strong and equal bilaterally. And now I'm going to be checking for his posterior tibialis, which is behind his malleus. Okay, making sure it's strong and equal bilaterally. So pulses over here, and then checking for dorsalis pedialis as well. So right above on his foot, above his foot. Okay, and making sure those are strong and equal bilaterally. After I check the pulses, I'm gonna be checking for capillary refills to all fingers. So making sure circulation is good. Normal capillary refills is less than 3 seconds. Good. Okay. And I'm also going to be checking his toes bilaterally, making sure capillary refill is good. And then lastly, I'm going to be checking for his color, cyanosis. I'm checking for any splinter hemorrhages, for any abnormalities or defects there may be. I'm also checking for tar staining as well as edema. I think that concludes for our cardiac assessment. Do you have any questions? Otherwise, the exam was normal and healthy. S1 and S2 is noted, with no abnormalities noted.
Thank you.
Okay. Thank you for your service and time.